My name is Edith Mtunga. I'm from Malawi, Liongwe. I came here to Manipal Hospital because I had problems with my legs, especially knees. I couldn't walk, and this problem has been there for more than 10 years. So throughout I was looking for a help, been going to hospitals, but then they told me I have to have a knee surgery. So somebody recommended the Manipal Hospital to me, and that's why I came here. I met Dr. Sunil Kini. He was really nice, and he assured me that the surgery will be done. I'll be fine once again.
I first saw Miss Edith Mtunga, a 62-year-old female who hails from Liongwe, Malawi, in my outpatient clinic about a month back. To give you a brief insight, she complained of both knee pain since 2002, which only increased over time. She received multiple injections for both her knees for the same, but gradually the pain continued to increase to such an extent that walking a few steps without pain and carrying out daily activities was increasingly becoming painful. And X-rays revealed advanced arthritis of both knees. We counseled her that the only treatment possible to restore her mobility would be a knee replacement surgery. We counseled her the same and the advantages of that being explained. Both her knee replacement was done using the Mako assisted robot, and patient continued to do well post-op recovery.
So since after that I've been having a physiotherapy, helping me how to stand again like a baby, to walk, and now at least I can stand on my own. I can walk some steps. I know with time I'll be walking. I really want to thank Dr. Sunil Kini for the good job he did with love. That's what I saw that.
These kind of robotic joint replacements require a multidisciplinary setup in form of an expertise surgical team, post-operative analgesia, anesthesia team, and nursing and physiotherapy to ensure an excellent outcome. And we at Manipal Hospitals, Old Airport Road, Bangalore, are well equipped to do these kind of complex hip and knee replacements.